Good evening, everyone, and thank you, Carlene, for that just really amazing introduction and for talking to so many people about a little bit about my history. I really appreciate that. What an amazing night of fellowship this has been. From one story to another, all 6 of the Spurgeon Award winners were just so inspiring, didn't you think? Just amazing, just amazing. And I've been reflecting recently on how fortunate we are to live in this community where so many individuals and so many organizations are taking the lead to make our community a better place. And the Boy Scouts play such an important role preparing young people to be leaders of the future by giving them opportunities to build character, to find joy in service to others, and to learn about the importance of protecting the environment. You saw a lot about the Remark family getting out in the environment through our pictures. My family has benefited really quite a bit from the opportunities that Scouting has provided to give back. My husband Roger and my daughter and son are both here tonight, and my husband is an Eagle Scout himself and has served in various roles from adult leader in Cub Scouts and Boy Scouts to most recently serving as an Eagle Scout coach to Troop 283 out in Wayzata. And this is a big month in the Remark house from a Boy Scout perspective, as our 16-year-old son Gavin, who's here tonight, will have his own Court of Honor ceremony in 2 weeks celebrating his own Eagle Scout accomplishment. So pretty excited about that. Now, as Carlene mentioned, 2020 will mark the 25th year I've been a leader at Health Partners, and it has really been my great fortune to land in an organization that loves to give back. When I started at Health Partners in my early 20s, I had an expectation that I would be there 3 to 5 years and had no ability to actually foresee how many amazing opportunities this organization would give me and my family. And like so many of you here tonight, Health Partners prioritizes looking beyond the walls of what we do to make our community a better place. And what I also appreciate about the leadership at Health Partners through Mary Brainerd and today through Andrea Walsh is that they encourage not just leaders, but all employees to think about something they're passionate about and go after it, and also the ability to use work time to make that happen. And so at Regions, what we have really focused on, our leadership team, is really comes from those social determinants of health, which I'm going to share with you a little bit tonight. And so our team has been focused on the fact that research shows that only 20% of a person's health is determined by their interaction with doctors, with hospitals, and with clinics. So while we think we provide a really important role in the community, we play just a small part of an individual's overall health. 80%, an overwhelming 80% of a person's health is determined by their education, their access to stable housing and healthy food options, and opportunities to make a livable wage and live in a healthy environment around them. And what's the most single important determinant of health and well-being and longevity? And that's having a high school diploma. And so as we as a leadership team have really looked at the role we play, we have taken that knowledge, and with the help and support and encouragement of our governing board and the Regions Hospital Foundation Board, we've pursued work to really help work on that 80% of those social determinants that really makes a difference. So tonight I just want to share just 2 examples of amazing work going on that I hope you will see as a way in which Minnesota is really trying to make a difference. And this is work happening right here that's nation leading, focused on solutions that positively impact our community. Carlene mentioned both of these, and I thought I would just share with you a little more detail on the difference that these organizations are making that I have learned to love through board service. So first, Serve Minnesota. We live in a state that gives generously, not just financially, but also gives significant time to making a difference. And I don't know that all of you here tonight know that because of the intentional work of Serve Minnesota, it's the organization that deploys more than 2,000 AmeriCorps members in the state of Minnesota to education, to the environment, and to community building. Minneapolis-St. Paul has the highest number of AmeriCorps volunteers per capita of any city in the country. And we're second in the country only to California on the number of total AmeriCorps volunteers who are deployed in the state. And when you think about the state of Minnesota population, that is an amazing tribute to the amount of volunteerism of new college grads, recent retirees, people in between jobs, all looking to help make a difference in the state of Minnesota. So a little bit about the statistics of what the AmeriCorps volunteers have been able to do. We have AmeriCorps volunteers in 600 schools statewide, touching the lives of 30,000 students, 70% of whom are racially diverse, with the goal of helping improve these students' math and reading skills and significantly trying to help decrease the achievement gap between our white students and our students of color. So just an amazing feat. The second organization I want to highlight is the Central Corridor Anchor Partnership. I think this is one of the biggest secrets in town. Central Corridor Anchor Partnership is a long name we fondly call CCAP, and I had a great opportunity to get to know Rasul a little bit better through this work and join him on the executive committee. CCAP is the largest partnership of its kind in the United States. And this consortium, which consists of 10 organizations, healthcare institutions, higher education partners, and now financial institutions, really located along the Green Line between Minneapolis and St. Paul, have come together for many years to focus on 3 key areas: to spend more of our procurement dollars from our 10 organizations with local businesses, to invest in educational opportunities to hire more residents of the Central Corridor neighborhoods, and to increase transit use by students and employees with an overall goal of bringing more transparency to our, more transparency, well that too, but really to bring more prosperity to the Twin Cities. So here's just a few statistics about what CCAP has been able to provide. Through CCAP, we have boosted the percentage of local residents in the Green Line being employed by these 10 anchor institutions from 13% to nearly 20%. That's 20% of our local community being employed in these organizations. We've increased the amount of local purchasing, and one of our goals at Regions Hospital has been to increase buying locally from a food and beverage perspective, and in 2018, 30% of the spend at Regions Hospital has been through local farms and local businesses. Each year, CCAP sponsors what we fondly know as Scrubs Camp. It's hundreds of kids that come together, put on scrubs, and learn all they can about various healthcare careers beyond being a doctor, beyond being a nurse. And it gives high school students hands-on experience and exposure to a variety of healthcare careers that will also help us address what we already see as an upcoming labor shortage. This year alone, we had close to 200 high school students at St. Paul College and at Augsburg participate in Scrubs Camp, and scholarships were provided to over 50% of those students so that financial support was never a barrier. And finally, we've initiated a fellows program, which we're really proud about, providing inner city students at 2- and 4-year colleges paid healthcare jobs in healthcare and actually in the banking field while they're still in school. And that gives students along the Green Line access to higher wages than typical college jobs and access to being hired by our organizations once they're done with school. And finally, I'd like to talk a little bit about the work we're engaged in at Health Partners and Regions Hospital. Health Partners is the largest private employer in St. Paul, and given our long-standing presence and depth of service in healthcare, we've been an active partner and convener of opportunities to improve health and well-being. Our Health Partners priorities include improving health equity and reducing disparities and access to care, reducing the stigma of mental health through our Make It Okay campaign, making it more comfortable for people to talk about healthcare issues and mental health issues, just like you would diabetes or cancer or any other physical health issue. We are committed to improving access to wellness and prevention programs in our schools, and one of our highest priorities is improving children's health. Now, children's health has been a hot topic in Minnesota, and for good reason. As we all know, children's health is a top priority for our governor. Last month, Governor Tim Walz lent his support when he spoke at an event, the 4th annual Little Moments Count annual symposium. Little Moments Count is a statewide coalition led in partnership by the Health Partners CEO, Andrea Walsh, and we have brought together the last 4 years over 200 community organizations and not-for-profits focused on children's health during the first 3 years of life. This work really includes creating a movement and getting the word out about the importance of early brain development early in life. And so what is the reason for all this work? Why now? Well, an alarming 1 in 3 American children start kindergarten without the language skills that they need to read. And half of our lowest income homes do not have one single book. So given these statistics, Health Partners has led the way with other healthcare institutions to implement what we know as Reach Out and Read. It's a program getting children's books in the hands of every parent and child to assure children have the best chance of developing healthy brains early in life. Starting with prenatal visits, mothers-to-be are given a book at each clinic appointment, and at Health Partners, we've distributed more than 90,000 books. But across the entire state of Minnesota, there have been more than 225,000 books given and over $500,000 spent this year alone from all the healthcare institutions as far north as Bemidji, as far south as I think the state of Minnesota goes, and across the Twin Cities. And someone else who's leading this vision of providing a good start for children is our own St. Paul Mayor, Melvin Carter. Starting in January, every child born in St. Paul will receive $50 towards a college savings account thanks to Mayor Carter and the soon-to-be-launched College Bound St. Paul program. We were proud to have a few members of our region's hospital leadership team involved in this initiative, and our real hope is that Regions Hospital has the first baby born in St. Paul, and the mayor will come over and give that first $50 savings bond to that first baby born in St. Paul. United Hospital and Regions have a friendly competition going on about who's going to have the first baby of the year. So as I conclude my comments tonight, I just want to mention that as a leader at Regions Hospital, I have been given this amazing gift to lead a team that is there when people need us the most. I think you can probably agree with me that most people don't start the day expecting to end up being a patient in a hospital. And so our team is ready 24 hours a day, 7 days a week to be there for both the expected joys like having a baby and the unexpected hospital visit due to a trauma or an accident. I'm proud of the longstanding history of Regions. We've been an anchor partner here in the community since 1872, and we started in a 10-bed mansion. We've come a long way since then as a level 1 pediatric and adult trauma center that's also a safety net hospital. And we're working really hard to be a place where everyone feels welcomed, included, and valued. And our leaders and employees are actively working to reduce bias, to be more inclusive, and to earn the trust of every single person who comes to our door needing help. And Rasul said earlier, we know that we all do better when we all do better. And I truly believe that this community is really focused on making that difference. So a few things that I've learned about community engagement. The first is that health is universal, that every single person wants to be healthy and wants to be happy and wants to be given a fair shot. That through building trust, I've learned a lot about listening more and talking less and being open to others' perspectives. And last, but probably most importantly, that you don't have to be in a formal leadership position to make meaningful change. And it doesn't have to be a really huge initiative. That small acts of kindness are as meaningful as large, big initiatives, because you never know when you're going to be the one person to help that one other person. And I see that happen every day at Regions Hospital. So I hope tonight you've been inspired by all that is happening for good in Minnesota, and that we have a lot to be proud of. And we still have a lot of work to do from a disparities perspective, both in health and education. But I'm really optimistic. My advice for 2020, make a New Year's resolution to get involved or get more involved. Get inspired by something that you're passionate about, and think about what's one new thing that you can do to make a difference. That sense of community starts with all of us here. And it's those individual intentional acts of kindness and caring and volunteering and giving of ourselves to improve the lives of others. And I was inspired tonight by so many of the stories that I've heard. So thank you for this wonderful recognition. And I want to most importantly thank my favorite 3 people in the whole wide world, my family, because if it wasn't for all of you, this wouldn't all be worth it. And your support and your encouragement and the fact that you bring joy to my life every single day makes it easy for me to go to work and easy for me to do this job with a lot of energy and enthusiasm. So thank you to my family for making it all happen. Thank you for this honor tonight, and I look forward to what's ahead in 2020. Thank you.